the privilege of the floor. Anyone wishing to speak, wait to be recognized. Please state your name and address. Limit your comments to 3 minutes and remain in the back of the room. Okay? Thank you.
All right, Dr. Lisa Barr, Oneonta, New York. I'm remaining in the back of the room. I notice you have it clogged with all these desks so that we can't come and observe you doing the business of the county, and that's shameful as it is. What's also shameful that you have your meetings in the middle of the workday so that working people can't come to see governance. This is not democracy. I'm here to address the claim that you guys are getting ready to support Faso's nihilist repeal of the American Care Act, the Obamacare Act that saved my life, that saved my brother's life. I got $20,000 worth of heart screening last year that saved my life. My brother had a pre-existing condition. He had prostate cancer. He worked for General Motors for many years in Michigan, probably paid more taxes than most of you on the board. But later in life, he couldn't do it anymore. And he was paying $960 a month before Obamacare for his health care. And ACA went through, which Faso wants to repeal. The ACA went through, and his insurance payments are $300 a month. You know, it's a big person who can admit that they made a mistake. To my friends on the left, and I consider everyone in this room a friend, and my friends on the right, we need to admit we made a mistake, okay? John Faso is not fit to serve. The fact that he would want to repeal this law, and I want to apologize, I have to go to work, and that's why I wanted to run up and speak. I got hired at one of the local places here, and I'm going to be a prep chef. And I'm going to be paid $9.70 an hour by a company that makes millions of dollars for a product that's a tourism attraction and sells millions of dollars worth of product worldwide, okay? And I'm going to have to buy my own, if I want the chef protective coat, I'm going to have to buy my own coat. So I'm about to go off to work for minimum wage in Otsego County, which is not unusual around here. And I'm going to have to risk my life with burning oil and burning water. And you guys would want to support this bill that would mean that I lose my Medicaid? Think about what you're doing. This is a very wrong thing to do. And for my friends on the left who had to keep their Bernie bumper stickers on during the last campaign and couldn't support Hillary Clinton because she had tried but failed to get single payer. We're not going to get single payer anytime soon. Obamacare is it for a while. And if we lose this, we will be losing a lot. So those of you who only recently got involved in politics after you retired and don't know how to read the smoke signals, take the Bernie sticker off right now, okay? And please do not support John Faso in his nihilist effort to end health care. Thank you.
Good morning. I'm Doug DeLong. I live in Roseboom. I have two conflict of interest I should say right up front. First of all, I'm the chief of the Division of General Internal Medicine at Bassett Healthcare. 25% of our clientele, our patients, are on Medicaid. And also, I'm the immediate past chair of the Board of Governors of the American College of Physicians. That's the largest specialty organization of physicians in the world. And it has been standing with virtually all the rest of professional medical societies in opposition to the current repeal and replace efforts that are going on in Washington. Six weeks ago, I was lobbying in Washington, D.C. with Congressman Faso one-on-one, but now it's not time to do some lobbying here locally. So I just want to make 2 points. I'm here to oppose the resolution. First of all, I think it is financially irresponsible, and secondarily, or maybe primarily, it's morally unacceptable. It's financially irresponsible because you all are very sophisticated in the way that Medicaid works in our society. It's a 50-50 match, and actually in this state, because we're one of the expansion states, we get 90% of the added folks there. If less dollars are going into Albany That means less dollars, unless Albany decides to raise all of our taxes, less money would be coming from Washington, D.C. to the Medicaid pool, which is, again, 25% of the citizens of this state, that's their insurance. It's also morally unacceptable. 70 million Americans are covered by Medicaid currently. I do a lot of geriatric medicine. In our lifetime, in this room, 1 out of 3 of us, so if there's 12 of you at the board, 4 of you will sometime in your life be in a nursing home. 2/3 of people who are in nursing homes rely on Medicaid to pay their bills. It does not matter how wealthy you are. I've had, when I used to take care of patients, that was formerly the Meadows and then became the Manor and then is now in Focus. I've had people of all walks of life in there, and most of them are supported by Medicaid. So I'm asking that you not support this well-intentioned, I think, resolution, but because it's just completely, you need to do your fiduciary responsibility to protect us financially, and also you need to protect the most vulnerable in our society, our elderly, the disabled, children, and the poor. Thank you.
I'm Antoinette Kosminski. I'm a retired physician. I worked for 40 years at Bassett Healthcare, and I'm here to urge the county board not to endorse Federal Bill H.R. 1871, the Property Tax Reduction Act. Some members of this board may see this as a straightforward blessing in that it appears to relieve upstate New York from an unfair tax burden, but that is a mistake. Most obviously, this bill is unconstitutional because it interferes with states' rights to regulate their own taxes. And New York State Attorney General Eric Schneiderman has already gone on the record stating that he will sue if this bill becomes law. But more importantly, this bill simply throws a bone to county governments to gain support for the long-term gutting of Medicaid. And if this bill were to become law, one or both of 2 things would happen. New York State will find another taxation method to replace federal and county monies, or Medicaid programs will be radically cut back, or both. And aside from the fact that the citizens' total tax burden is not likely to change meaningfully, let's be clear about what this means for Otsego County. Collectively, healthcare and long-term care facilities such as Bassett, Springbrook, Focus, Foxcare, and Pathfinder Village are the largest employers in Otsego County. In turn, there is an economic cascade of benefit which engenders numerous spin-off industries to support these institutions. These jobs are high quality, non-injurious to the environment, and non-seasonal. Unlike the possibility of future jobs, which the county board is hoping to create through various attempts at economic development, these jobs already exist and are the lifeblood of our community and deserve to be supported. The budgets of these long-term and healthcare institutions are heavily dependent upon Medicaid dollars. Any destabilization of reimbursement results in immediate financial crises, especially for a not-for-profit institution like Bassett, which already operates on a very narrow margin. Having worked at Bassett for 40 years, I can tell you that the hospital will continue to provide service for all comers, regardless of whether they are known to be able to pay or not. But non-reimbursed care results in a financial crisis and ultimately in layoffs and programs cut, which I have experienced at Bassett in the past. Given the magnitude of the proposed pullback over the years of Medicaid, this is a true threat to the quality and even survival of these institutions. And I wish to emphasize that gutting Medicaid does not just injure people who no longer have health insurance. The collateral damage of loss of services would affect virtually every one of your constituents, young and old. And next time a family member of yours has an acute head injury, think about what it takes to have expert neurosurgeons on call 24/7 year-round. And how about when Granny needs rehab after a stroke, or even long-term placement if she can't take care of herself, but the nearest facility is 75 miles away? If you look under the hood of this proposed legislation, it becomes clear that the benefit of an end to property tax is more than offset by the potential damage to our economy and our quality of life. Please do not make a penny-wise and pound-foolish decision such as that which the county board made when they sold the manor to the highest bidder but the lowest quality provider, who turned our 5-star nursing home into a 1-star embarrassment and a health hazard for our residents. I urge the members of the county board to reject rather than endorse H.R. 1871.
Here. Good morning. I'm Chris Colby. I'm a practicing pediatrician. As I look around the room, I think that I have treated many of your children and perhaps some of your grandchildren. I think you're all a little too old for my practice, however. I am the co-director of the Bassett Healthcare Network's school-based health program. It's a program of 20 school-based health centers in 15 school districts, and we provide primary care, mental health care, and preventative dental services to over 7,000 children and adolescents in 4 counties. In Otsego County, we serve the children in Richfield Springs, Edmiston, Lawrence, Morris, Cooperstown, Worcester, Skenebus, and Milford school districts. Additionally, many students who use the school-based health centers in Unadilla Valley Central School and Sydney Central School are actually Otsego residents. Gilbertsville, Mount Upton, and Cherry Valley Central Schools are asking us to establish school-based health centers in their schools. It's a popular program. Last year, there were over 35,000 visits by students to our centers. Some of our centers have been in existence for over 20 years. In other words, kids who are graduating today have never not known a school-based health center. In the school-based health program, we do the best job that we can to address broad healthcare needs of the children in this area. We receive a patchwork of funding that includes some New York State support, some federal support, some grant support, and we bill insurance, including Medicaid, in the school-based health centers. Over 50% of the students enrolled in the school-based health program have Medicaid or Child Health Plus, and we have 85 to 97% of the students in each school district that are enrolled in our program, which is pretty darn tacit agreement or approval of the program. The program does not break even. Bassett Healthcare absorbs the deficit. The Faso Collins amendment to the AHCA would have serious adverse effect on the viability of our school-based health program and on the health and well-being of children and adolescents that we serve. I am not an expert in healthcare financing, nor am I an expert in managing the public funds. However, I am acutely aware that children in rural areas across our country have poor outcomes due in part to poverty and to limited access to health care. Access to health care is improved by having school-based health centers right in the schools where children spend so much of their time. But these centers cannot and will not be sustained without reasonable funding streams. Medicaid covers children from low-income families and children with special health care needs. Medicaid reimbursement is an essential part of school-based health program funding, and the Faso Collins amendment makes no provision for replacing those funds that are in jeopardy. I believe that the proposed endorsement by the Otsego County Board of Representatives of the Faso Collins amendment is a bad idea. I believe that an endorsement without careful consideration of all of the ramifications of the amendment in Otsego County would be hasty, even reckless. In my opinion, the amendment, as it stands, is a quick fix for a very, very complex problem. That problem, as I understand it, is the need to support important, even essential, and sometimes controversial human services without a funding mechanism defined by consensus and compromise. I encourage you as representatives of our county, representatives of the constituents of this county, and most importantly, as representatives of the children of Otsego County, to continue to struggle with the problem of healthcare funding for the needy with the limited resources at your disposal. But I implore you not accept a seemingly easy fix at the expense of healthcare for adolescents and children. Please do not endorse the Faso Collins amendment as it currently stands. And Ms. McGovern has a copy of my comments. I'm happy to answer any questions. And I will hasten to add that I would be happy to be part of a solution with my limited expertise in child health care.
Thank you.
Hi, I'm Leslie Berliant from the town of Middlefield, and a number of people who couldn't be here today sent me comments that they asked me to read on their behalf. First, from Elaine Mosher-Campoli in Oneonta. As a Medicaid service coordinator for individuals with developmental disabilities who depend on Medicaid for their daily care, I'm concerned for what the AHCA will do to gut funding for services they need for their safety and quality of life. As a family member of someone who needs significant mental health care, I am scared for what cuts could mean for families like ours when we are already constantly on the edge of not being able to afford necessary care. As a human being, I am disgusted by what this says about our humanity, that our administration is considering a bill that would result in 22 million people losing coverage. I urge the county board, please do not pass a resolution to support any aspect of the AHCA. From Janine Webster in Cooperstown. I am writing to urge you to vote against the Faso Collins amendment to the American Health Care Act, or at the very least to educate the board by bringing in a panel of fiscal and medical experts who are knowledgeable about what the approval of this act would mean to Otsego County before a decision is made about something of such vital importance to the people of this county. I think it is a mistake to assume that Congressman John Faso has our best interests in mind in creating this amendment. Our county stands to lose an estimated 1 million and countless jobs in healthcare-related fields if this amendment is approved. This loss of revenue and of employment opportunities will have a devastating impact on our communities. Please do not consider approving this amendment without complete understanding of the consequences to our county. There's too much at stake to act hastily and irresponsibly. In my opinion, the Faso Collins amendment will devastate our economy and the health care of many of our residents. From Kathleen Taylor, who spent 10 years in public service from Cherry Valley. I've lived here for almost 30 years, almost all my adult working life. I've raised my family here. I've been employed in Albany County and in Oneida County. And the only paid work I've ever had here has been part-time or freelance, second jobs. We don't have many employers in Otsego County, and healthcare is a big employer. Pledging allegiance to this amendment is pledging support to the penny saved, $200 to $500 per property according to Faso, while closing your eyes to the serious dollars that will be lost. If the AHCA passes, which this amendment and your support makes more likely, rural hospitals will be hard hit. Dr. Streck predicts Bassett will go under. I urge you to not vote your support for an amendment that will lead to loss of health care and jobs for Otsego County. Speaking for myself, I did the research. The CBO, the Congressional Budget Office, which is nonpartisan, says if the AHC passes with this amendment, 3,000 elderly people in the 19th Congressional District will lose Medicaid. 29,000 of our residents in the 19th Congressional District will lose health care. This county alone will lose a minimum of $797,000 at minimum. That doesn't even count the $2.3 million that the AHC takes away from New York State and the additional $2.3 million that this amendment would strip from this state. In addition, there are 18 other states that have county contributions to Medicaid. Florida, Pennsylvania, Wisconsin, Illinois, Ohio. Are you seeing a pattern here? They all have Republican governors. This is a cynical political move designed to force a Democratic governor to raise taxes. That is all this is. The money is going to have to come from somewhere, and this board supporting that amendment is bad for the county, and it's bad for all of us.
My name is John S. Davis, MD, and I'm a longtime resident of Otsego County, and I live at 190 Ottaway Road, the town of Middlefield. I'm simply going to echo some of the wonderful comments that have been made. Since 1956, I've participated in the treatment of thousands of patients at Bassett, including the poorest of the poor. I always strive to give the best possible care to all patients, no matter what their economic circumstances, and I believe that this is still the norm and the goal for all providers in the Bassett Healthcare Network. The network, including Fox Hospital, constitutes by far the county's largest employer. Financial margins of the network remain increasingly slim, as has been pointed out, as it strives to carry out its patient care mission. So I'm simply asking every representative on this board to be certain they fully understand what passage of the Faso Collins Amendment to the American Health Care Act will mean to the medical care for Otsego County's most needy patients. As I see it, this should mean a clear no vote for the proposed resolution as it's currently written. Thank you.
My name is Richard Sternberg. I live in Cooperstown. I am a retired Bassett orthopedic surgeon. I am a trustee of the Village of Cooperstown, though I speak for myself. I've heard other people speak much more eloquently on some of the basics of this, and basics of loss of health care or decreased reimbursement for health care for many of our citizens. I will speak to two issues. One, federal government mandates, even under the current administration, mandates that anybody who shows up in an emergency room must be treated regardless of ability to pay. As people have less ability to pay, the hospital will eat more and more of this. Furthermore, as people have less access to care before going to the hospital, they will present sicker to the emergency room, which will cost the hospital even more dollars. For people who think that Bassett can't close, I'd like to point out the story of St. Vincent's Hospital in New York. St. Vinny's basically covered all of Greenwich Village, all of the surrounding communities down to the tip of Manhattan. They had to give care no matter people's economic status. St. Vinny's borrowed and borrowed and borrowed, and eventually the bill came close to $1 billion. It cost them $1 billion a year to run, so they were about a year behind. The ultimate thing was they closed, and the buildings were converted to luxury apartments. Significant hospitals can close. Bassett can close. Bassett is the biggest economic driver you have in this county. And if you're responsible for Bassett closing, it will be unfortunate for everybody's political career. Sorry. The next point is, why is this even being voted on here? This has no bearing. This issue has no direct bearing on what's done in this council. What you say doesn't matter. It's a matter of support. Well, I'll remind everybody, you're all running this year. Go ahead and get out there and make your individual political statements. I support Faso Collins, I don't support Faso Collins. But to make it on the behalf of the county is ridiculous. Thank you.
My name is Maryann Karl, and I live in Cooperstown on the Middlefield side of the village. And late last night, I heard that this meeting was going to be held, and realizing there's hardly any room for anybody to get in here, I thought I would collect some signatures of people who were against this so that you would know this opposition is pretty widespread. So here I am with almost 40 signatures opposing this amendment. And so I'm going to hand this to somebody. Hope you'll look at it. It's pretty conclusive that many of your constituents are very much opposed to this. Thank you.
My name is Donna Barron, and I live at 33 Brook Street in Oneonta. I'm here this morning to oppose your sending any resolution pertaining to House Resolution 1871, whether it be the original version or the suggested changes made by Mr. Stammel. Let me tell you why. I understand why you don't wish to be responsible for the unfunded state mandate of Medicaid, and that the changes to the health care legislation promulgated by Representative Faso may be appealing to this body, but I think your supporting this change in any way is short-sighted. We live in one of the poorest counties in New York State, and changes in Medicaid will sorely affect many of our most needy citizens. If the version of the health care legislation that is currently in the Senate is passed and then supported by the House of Representatives, we will see significantly less federal money coming into the state starting in the year 2020. Right now, 75% of Fox Hospital revenue comes from Medicaid. There are 29 hospitals in New York State that are on the verge of failing, and even with Fox now being part of the Bassett system, it will not survive these severe financial losses. I think we need to think of the implications of losing one of the hospitals in our Otsego County. 2/3 of all Medicaid funding is spent on long-term care for our disabled and our elderly residents. Many people spend down their savings in a long-term care facility, and then if life goes on, they go on to Medicaid. What will happen to these people? Half of that pot of the Medicaid money goes to community-based services, keeping people in their homes, which is the cheapest way of providing services for them. It is used for the quadriplegic people whom have an aide to do personal care to help them stay in their homes. It is used to care for people with limited intellectual ability. Half of the babies born in the U.S. are paid for by Medicaid money. What you are doing if you send this resolution is to send a message to Representative Faso expressing that you support his amendment and support his position on the health care bill. Do you really want to do that? Do you really want to support less money coming into New York and less money to serve our residents of Otsego County? You know that if those covered now by Medicaid lose their coverage, they will get their health care at the emergency room at exorbitant cost to all of us. Please don't send a resolution that supports our representative to vote for a bill that will hurt our friends and our neighbors.
My name is Kathy Maxim, and I'm a retired teacher. I taught in the Gilbertsville Mount Upton School District, and my representative here is Mr. Powers. I don't have the expertise of so many people that spoke before me, but I am very appreciative of the opportunity to share just a few of my own thoughts. I suggest that we take the time to face the fact that this bill that's going through the House and the Senate is not a health care bill. It's nothing more than a mask for tax cuts. It is a tax cut bill, and it's tax cuts for the wealthy. It actually reduces health care and services for Otsego County residents while ensuring tax breaks for the wealthy and the super wealthy, and this is shameful. The Faso amendment feeds into this false narrative that health care is all about cutting taxes. It promises a few pennies of savings in property taxes, incidentally disproportionately benefiting the wealthier among us, while reducing Medicaid funding and quality health care for working people. And of course, the naturally resulting increase in state taxes will affect all of us. I'm disappointed that our county board would even consider lending support to this misleading amendment and, by extension, supporting a health care bill favoring wealthier Americans. I do understand the need to reduce the burden of local taxpayers. But this issue should be addressed directly with state government and not hidden behind an endorsement of this punitive bill. Thank you.
My name is Maryann Karl.
Please wait.
Oh, sorry.
Recognized for some sort of order here.
Beg your
Go
pardon.
ahead now, state your name and.
You can go ahead.
Can I go ahead? My name is Maryann Karl. I'm a retired Bassett physician. I remain active with the American Academy of Pediatrics, the American Neurological Association, and so forth. I just want to review some basic statistics, and I apologize if this has already been done. But the population of Otsego County is about 61,000 people. We have 5,258 Medicaid recipients. The spending per recipient is about $2,000. Statewide, about 2/3 of Medicaid payments go to nursing homes, and the majority of Medicaid payments go to the elderly and the disabled. The Faso Collins amendment denies federal matching funds to counties outside of New York City. How do you feel about that? Unless the state picks up the local share. This would mean a loss of $600 million of federal funding that goes directly to counties and is used to reduce property taxes. State officials estimate a loss of $2.3 to $3.7 billion in lost Medicaid funding by 2020. The estimated number of people losing coverage in Otsego County is over 5,000 persons. The GOP bill would also result in job loss and the closing of an estimated 13 rural hospitals, and a devastating blow to nursing homes because of reimbursement loss. Perhaps it's not appreciated the extent to which major medical associations oppose the GOP bill. It's opposed by the American Medical Association, the American Academy of Pediatrics, the Hospital Association of New York State, the AARP, the American Hospital Association, the American College of OBGYN, the American College of Family Physicians, the American Psychiatric Associations, and many other healthcare organizations at the state and federal levels. In case you think it's a good idea to return Medicaid's funding decisions to the states, let's look at what just happened in Pennsylvania. Pennsylvania did not have a budget for 3 years. Now they have a budget. How was that reconciliation achieved? It was achieved by cutting Medicaid statewide by 10%. If you make a similar decision, I guess there are 14 members of the council, is that correct? Well, dividing that by the number of people who are going to lose insurance if this goes through, I think each one of you ought to divide it up. That's about 350 persons apiece. Go to 350 persons, each one of you, different 350 persons, and explain why you voted for them to lose their health care.
Hold your pause, we can move through this part. I'm trying to get everybody in here. Next. Yes. If there's anybody on the side of the room that wants to speak, or to be acknowledged, please move forward.
Good morning, everyone. I won't take up much of your time. My name is Janet Rigby, and I live on Elm Street here in Cooperstown. I am not a physician. I don't have stock in the medical community, although I do avail myself of their services when needed. I am a county property owner. I am also a small business owner. And as much as I appreciate your efforts to control our taxes, I think this, from a business sense, is an absolute disaster. There is no way that you can cut funding for the stability of such an important economic factor in our county. I got this message from Faso, Mr. Faso, and he says that working with him to help reduce my taxes, I'll save between $275 to $500 a year. Well, I have paid a quarter of my take-home pay for health insurance prior to the ACA. 1/4 of my take-home pay. That went first, before the food, before the other types of insurance, and the ACA has been very good for us. We are still in business. We are still contributing to the economy. We are not taking from anybody. And I would happily give $250 a year to $500 a year to keep supporting people in need. Our civilization is judged, a civilization is judged by how it cares for its elderly and its disabled. And when you start taking away this safety net of Medicaid, you will be causing, so the downstream externalities will be devastating. And so I don't want you to support this. I don't want your letter of recommendation. I would like to see you go the other way and actually start educating Mr. Faso on some of his constituents and the economics they're involved with.
Good morning, everyone. You all know me. My name is Maria Agello. I'm a county worker. I hope you had a wonderful 4th of July, but for a lot of people, it wasn't so. We have our veterans that are traumatized by the fireworks. Anyone in combat who's been in combat can understand that. Now we're going to be traumatized by people that are gonna lose their health care. Now, I'm 64 years old. I'm gonna be on Medicare next year. God only knows what my life is because, quite frankly, I lost my home. I've been before this board 35 times, asking for a resolution, asking for an ethics board, asking. They may surprise you. They may actually pull this resolution and listen to the public. But it has been my experience and a lot of people's experience, this is just for show. They're going to listen. Perhaps this board won't. This sitting board is different than the one I went before. Maybe, just maybe, they will understand that we're all going to get there one day. We will all be elderly. We will all have issues. We may have tax issues. Our children might die. Our spouses die. We're going to be left alone. And who's going to take care of us? You think the government will take care of you? It's the people in the government that take care of you. And we need elected officials, for the record, that have compassion and ethics, not money grubbing, profit making, whatever on earth you want to call this mess that we're in right now. I am a county worker. I see the people that come up to do their spend downs, and it breaks my heart. They can't walk. They can hardly get through the door, but they got to put down dollars so that their health care continues. Please, if you don't want to have mercy on me, because I'm still standing, and I'm going to keep coming back for 38, 40, 50 times until I get my home back, because you transferred it while I was still in court, and you're going to do right by these people, because one day you will be in their shoes, and you better pray you have an elected official that has a heart. That's all I got to say. I got to get back to work, everyone. God bless.
I'm sorry, go ahead, Adrian. No, go ahead.
Okay.
Go ahead.
You're a hard act to follow. I'm Adrian Kazuki. I'm a resident of Fly Creek and the moderator of Sustainable Otsego. I just want to second what Dr. DeLong said way back at the beginning of this, that this is a fiscally and morally reprehensible resolution. The only explanation for why anybody would pursue a fiscally and morally reprehensible solution that's been offered here today is for political reasons, to embarrass the governor to get him to raise taxes. And that's totally outrageous. It's the only explanation that makes any sense so far that I've heard. So I'm sure the county board, you guys want to think about this again, and in the face of that. And what you don't want to do is hold hostage, which is essentially what this does. Hold hostage the people of Otsego County, their health care and their welfare. You don't want to do that. Thank you.
People from the side, I'm Russell Aarons, live at County Road 26, 180, and I welcome you all here today. It's good to see you. Mrs. Karl, it's been a long time. Dr. Davis, so many doctors. Thank you, Jim. That I know, and to this board, I wish you'd kind of, if you wanted, I'd just take your desks and shove them up so there's room for the people, the taxpayers, to come into this room. Look at where you live here. I mean, you got big desks, papers spread out. Unbelievable. And you got health insurance for cheap.
We're paying
for cheap. And we're paying for your, in fact, we pay for you to come here. So when you live way out of town, Jim Powers, it doesn't too bad at 50 cents, 54 cents a mile. It's not bad. Keep the job. Health insurance, if you wreck on the way, you'll be taken care of. Now, in the meantime, here's our wreck. I'm going to squat because I do a little better. I talk to people this way a lot of times. I want to show that I'm humbled down in front of you. I'm no better than you. I'm a hard-working guy. I've been working day and night. They put me on call at 64 years old. Can you believe that the people that run the upper part of DSS is demanding that they get raises, Gary Cooknick, because you think that it's a joke? They're a joke at the state? What do you think of people like me, 18 years of doing this? And then you go and take our home. I'm adult protective. This state has laws against what you did. Look at the ethics laws posted right outside this. To take her home and sell it to a county management level employee is wrong any day of the week. Now, where have we gone with the ethics in this county? I live very close to the Focus home, where it used to be our nursing home. This board has accomplished, you could write it down, right here on this little note right here, you could put down what we've accomplished. It's disgusting. What you've done is you've eliminated good jobs, and I see the people that go down to the Focus now, I mean, it's pathetic. They don't even have a bus stop, if you ever noticed them standing on 28 out there in the weather. They don't even have a shelter of anything. A couple pieces of plywood maybe to help them. It's not even there. So this county has a lot of work to do. And ethics is where you start. Now I'm going to ask you for one thing. I should have started it with this. This year, you pass a resolution to take the money from the taxpayers that owe their delinquent taxes up to the business day prior to the sale. This is the way we always did it in this county. Somewhere along the line, when Dan Crowell came in, we changed the process without the public even knowing it. And that's why we're here today. Maria Jello had the money more in full. She and her husband bought that land 20 years ago. They probably made the mistake of moving up from northern New Jersey, coming here. They built that house with everything that they had. It was the only home they ever had. 33 years of work went into that home. She has a son. She has a mother that may want to live up here someday. So give her her home back. And Bob Force, for all of you that have your computers, like board members that are sitting here texting and others that are chewing your gum, try Save the Force Farm. Save the Force Farm, and that's Bob Force. He hasn't quit yet either. Shame on you. Thank you.
Good morning and thank you. I'm Nicole Dillingham. I live in Springfield Center. Getting back to the resolution that is before you, and before I start, I just want to thank the physicians that are here today. I counted 6 present and retired physicians who have not only been treating our families all of these years, taking care of us, but had the heart and the generosity to come and share their expertise with all of us today. We live in an incredible community. They're the greatest part of it. They're also part of the greatest employer in our county. So Bassett Hospital is important to us ethically, morally, certainly in terms of our medical health, but also in terms of our environment and our economy. So let me get back to this resolution. There are a lot of physicians who spoke and others. I am more legally oriented, and I tend to look at what the resolution actually says. And Dr. Colheed said, well, it's an easy fix. I submit to you that if you actually look at what the resolution says, it isn't a fix at all. It does nothing to fix high property taxes. Nothing. It simply lays out high property taxes are difficult for people to bear. We shouldn't pay so much in property taxes. It would be great if our taxes were lower. And it doesn't do anything to correct it because the actual governing language of the resolution says that you would support a bar of federal reimbursement for state Medicaid funds received from charges to local governments in New York State, excluding New York City. So what the resolution actually does is simply bar reimbursements to Albany. Our property taxes would stay the same. We would still be paying the same amount for our Medicaid expenses because we need to support our community and because the law hasn't even been changed. By the way, the resolution is attached to a law that, as far as I can tell, isn't really the law yet, isn't going anywhere because there are countless amendments, and some people say there's going to be a repeal and replacement, or no repeal and replacement, an amendment, who knows? So you don't need to take this on now.
Right.
The resolution doesn't accomplish anything for our county. It doesn't lower our property taxes. It antagonizes the state government by denying the state federal money. Why do we want the federal government to keep our state's money? The state's money could be used for us, for the state. And by the way, if we really want to lower our property taxes and somehow revise somewhat how Medicaid reimbursements are handled, maybe we should form a group with other counties in our position, go to Albany, and talk to our state representatives and perhaps the governor's offices and work out a solution that makes some sense without having deprived them of reimbursements that they need to help other New Yorkers. How do we look as Otsego County, little Otsego County, one of the poorest counties in the state, we've just been told. We're one of the poorest counties, and we want to deprive other New Yorkers of reimbursements that the federal government would make to the state that would be available for us and for others? It makes no sense. At best, you should table the resolution, but really what you should do if you really wanted to be leaders, you would reject it outright and support this community. Thank you very much.
James Steen, 15 Delaware Street. I cannot add to what's already been said. I think it's all been wonderfully stated. I just want to say I'm against this resolution, and I personally feel that this is an attack on the poor, and that's how I see it. And that's all I have to say, and thank you.
Thank you.
My name is Brian Flynn. I'm running for Congress in the 19th Congressional District. I want to thank you all for the service, everyone in this room, for the service that you're giving to Otsego County. And I want to thank you all for listening to the people here today and compliment all of you for all the work that you've done. What this bill does, not just the Faso Amendment, but the health care bill, is it takes money away from the poor, the sick, and elderly, and transfers it to the investor class. And the important thing here is the reduction in taxes is to capital gains taxes. Now, unless everything we've said here today is wrong, unless Otsego County is filled with a bunch of wealthy investors, then the AHCA doesn't make any sense, and this amendment doesn't make any sense. I've been running for office for a few months, and I've been to Otsego County 10 times already, 3 times just this weekend. And I can tell you this, the people in this county appreciate the work that you're doing here. But what I hear from them, what I hear that they need, is they need affordable health care. And what we're doing, for political reasons, is taking that health care away from the working people and giving it to the investors. And for what reason? There's nothing in there that's going to make health care better. And what we just heard is this amendment doesn't necessarily reduce your property tax, which is a concern I hear all over the district. So I just want to thank you all and compliment you for what you're doing here today, and compliment all of you, and I look forward to working with all of you when I replace John Faso.
Yeah.
Good morning. My name is Paul Mendelson. I'm from Cherry Valley, New York. And my question is this. If you were to reduce my county taxes by, let's say, $1,000, can you give me any reason to believe that when the governor raises my taxes by $1,000, that's the amount that we'll get back here to heal the sick and keep our institutions open? My other question is, if that happens and your county taxes are reduced by X percent, can you give me any reason to think that they will stay reduced by that amount? Anyone? Any suggestions? Okay, thank you very much.
Yes.
Hello, my name is Gina Keel, Hazel Street, Oneonta. I bought a house 2 years ago. The assessment went up double. I didn't fight it. I'm willing to pay thousands of dollars in property taxes. Yesterday I was at the park for 4th of July celebrations. I didn't see a lot of suits and ties there. I saw a lot of poor people. I saw a lot of people that depend on care. 1 in 5 children in poverty in this country, and you're going to take away health-based school clinics? Crazy. Bassett Healthcare is phenomenal, world-class, rural health care network. Why don't you listen to the people that helped build it and those who have a direct knowledge of the consequences? We require students to present claims, reasons, and evidence. Your resolution is fallacial in its reasoning, and I require, as our representatives, that you look more deeply at the consequences and the economics, the analysis of your decision-making here. This resolution smacks of a political, short-term, electioneering effort And that is also despicable because you put the consequences of long-term health, welfare of our county at risk. You must not do this. You must vote no. We need a congressman that understands the math. And we need to be serious in our working with the state and the governor on the problem of funding, the local share. Absolutely, the challenges we face are serious. But this is not the way. This is cynical politics, symbolic, and think about everyone who is not in this room that will be hurt. They're working today.
Thank you. Okay. All right, if anybody's in the side of the room now, if you wish to speak, could you please come forward, because when you raise your hand back there. Okay, anybody else back there? Before she starts?
Dottie Hudson, Cooperstown, just down the street. I'm sure you've all learned a lot. My point to come here was to say, how much have you spoken to the people that work at the Bassett? And I'm so glad that some of the doctors I know have spoken to you, and I'm sure there are more who could give you more information. Another piece of information is this afternoon from 2 to 3, Representative Congressman Faso is going to be taking questions on WAMC. And if you call them, you can ask him questions. It's 97.3, and it should be interesting. Here's a picture that was in the New York Times Saturday. Faso doesn't care. It's an interesting, detailed description of what you've all been hearing about.
Thank you, Donnie. Thanks,
My name is Joanne Gardener. I live in Hartwick. Everyone has spoken so eloquently. I think the point has been made. I just would like to give you my perspective as someone who works in a school. I spend time with these kids every day. And the fact that you would give back $500 in property taxes to hurt these children is just unbelievable.
Shame.
Unconscionable. Not only the ones who are on Child Health Plus or Medicaid, but the ones whose parents work in the hospital, the ones whose their livelihoods are at stake. This is a beautiful area. I feel so fortunate to live here. Every day that I come into Cooperstown and go to work, I am just stunned by the beauty and the vibrancy and the wonderful community here. And the fact that you would try to rip that apart, these are your constituents. They're who you answer to. And you need to take that into consideration. Each one of you knows someone on Medicaid. I can guarantee it. Put that picture in your head as you sign this. Thank you.
Is there anybody else on the side? Come forward. Go ahead. You can come speak. I just want to line up for this.
Anne Marie Hasnettle. I live at 274 River Street in Oneonta. I just want to say, 30 years ago, my primary care doctor saved my life. She's in Bassett Hospital. I took Bassett, I was young and stupid back then. I took Bassett Hospital for granted. And now I don't do that anymore. I value them extremely. And they've saved my life more than once. So I want to keep Bassett. I can't imagine our area without it. It would be, I would say, equivalent to closing down SUNY, which is a huge place. So I am against this resolution. I would like to say that I am not happy with John Faso. I have gone to Delhi several times carrying my ACA has to stay signs, and I don't see that he's made much of an effort to talk to the little people. He goes to, where was it? At Otsego or whatever, to see the bigwigs, excuse me, talk to them, but he's not approachable. Thank you, Daddy, for telling us that we could call on the radio to talk to him today, but that's after how many months of people dogging him with signs to try to get through to him that we're not happy with what he's doing. So I'm happy to be able to come and speak here indirectly to say that I'm not happy with him, and I hope that you will send that message too. But he's not representing us well, and I'm not happy about that. So thank you for this moment to talk. Everybody did a fantastic job. Can't add to any of it except for my own personal story. Thank you.
Thank you. Thank you for your comments. I just wanna, go ahead, you got a question?
Yes.
Go ahead.
So there's obviously, strong feelings about resolution number 241 today, which came from this committee, and the minutes don't really reflect how it was crafted, where it came from, what efforts went into creating that. So I'm wondering if you can kind of share that with everyone.
That went through admin last month.
Yep.
Okay, I neglected to take that over to the attorney's office to have that drafted up for us to deal with a month ago. All right? I don't think it was proper at the time to just have a late resolution last month. Okay? So that's how it got. That was totally my resolution and the minutes from May, sure.
I appreciate not having it come in as a late resolution. So prior to that meeting, what was how was it drafted? How was it developed? I mean, they were asking if medical professionals were consulted, those types of questions. I know the Health and Ed Committee wasn't consulted on it, so I'm just wondering.
I was looking at it totally on a point of an unfunded mandate and how we can get it off our county taxes. Period.
Any further questions? Okay, question for the chair of admin.
Yeah. Well, I guess to admin and to Representative Gelbsman, because I'm assuming you were at that May meeting when this was discussed.
Yep.
But in the minutes, it specifically says. I'm sorry. In the minutes from that May meeting, it specifically cites that this came from Representative Faso. I mean, he specifically mentioned the American Health Care Act is specifically mentioned. Am I not correct in what's cited in the minutes? That's I can read them back if needed from May.
Well, he wasn't there.
Oh no, I know Representative Faso wasn't there. Correct? Yeah, obviously. But basically the minutes just they're pretty straightforward.
It was brought forth by Representative Frazier.
Right. It just says in here, committee discussed proposed legislation to amend the American Health Care Act, AHCA. Representative Frazier moved for approval to support Congressman Faso's stance regarding legislation to amend the ACHA. And then second, McCarty, total 2,145 A's, 1,795 yeses, noes, 348 Kutnick, and the motion carried. So I just wanted to be very clear. We were handed a piece of paper a little bit ago that said this resolution, HR 1871, is not the American Health Care Act, and yet the minutes specifically state that the American Health Care Act was discussed and that this was Congressman Faso's stance regarding this legislation.
I think I'll let Ed answer that, but what I just heard him say was he brought this resolution forth based on funding mandate. So I'm not sure the minutes are accurate, but Ed?
You're going to interpret that how you want. I mean, it is an amendment to a health care act. We are endorsing this amendment. I'm not endorsing a health care act, any of that.
Oh.
I wanted the $2.3 billion, the $10 million that's here in our county that we send to Albany, taken off the books. That's my goal.
So that's
the first conversation in 6 years since I've been sitting on the board to reduce and help that mandate that's unfunded here. That was the purpose of it. Okay?
So this is not the time to debate that resolution, that will come
Right,
when
I understand.
it's been
Yep.
pulled and we'll have it. That's why I asked if it's a question for the chair.
Yep.
So, Gary.
It is accurate that the American Health Care Act was discussed at that meeting. That's my fault, because I brought it up, and tried to connect the amendment to that bill in a way that I'm sure we'll continue to do later today.
Is there any representative wishing to remove a resolution from the consent agenda other than 238, 241, 236?
As chairman of the admin committee, I'd like to withdraw the Faso resolution.
From the consent agenda or entirely?
Entirely, with a vote from my committee.
I second your motion to withdraw.
But you just need your, you haven't told the committee yet. Yes, I agree.
Frazier?
No.
Kennedy?
Aye. To pull, yes.
And McCarty?
Aye. Aye.
Okay, so no, other than.
We won't vote on it.